Good evening and welcome to our COVID-19 update, a special edition on Channels Television on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. Here are some of the highlights this hour. Today, Presidential Task Force returns to Abuja, gives update on COVID-19 fight. More states adopt more restrictions towards curbing the coronavirus pandemic. And deaths in Spain rise for a second consecutive day as WHO warns against easing curbs. It's about 10 days since the federal government announced the restriction of movement in Lagos, Ogun State and the Federal Capital Territory. Thus far, 254 confirmed cases of COVID-19 is the total number after the Nigerian Center for Disease Control announced 17 new cases yesterday. 44 cases have been discharged, 6 deaths have been recorded. A look at the breakdown of the cases in each of the states shows Lagos with 130 cases, FCT Abuja 50, Osun with 20 cases, and the others. Of the Presidential Task Force are back in the nation's capital today. They resume daily briefing on efforts to curbing the coronavirus pandemic. All the activities of the task force will be on a transparent basis. And this is from the Secretary to the Government of the Federation, as he announced that the Catholic Church, through the Catholic bishops, have donated over 400 hospitals and clinics and public health specialists to fight the COVID-19.
I must emphasize that transparency and accountability shall remain the hallmark of all transactions under COVID-19 activities. Within the coming days, Nigeria shall be receiving equipment and other technical support through the United Nations system, as well as other donors. You will be adequately briefed when such deliveries are made. Early this morning, I had the privilege to meet with the leadership of the Catholic Bishops' Conference of Nigeria. I am pleased to inform you that the conference has placed at the disposal of the Presidential Task Force the entire 435 hospitals and clinics nationwide for use as part of the national response infrastructure. Similarly, the conference has released its public health specialists to support the Presidential Task Force in coordinating access and utilization of the facilities when the need arises.
On his part, the Minister of State for Health, Mr. Lorinimbe Mamara, who is taking the place of the substantive minister, is advising Nigerians to avoid wrong information to healthcare workers on their state of health. He also says the nation recognizes the role played by health workers this period.
I thank our health workers for their commitment, hard work, and sacrifice in the response to this pandemic that has drastically changed the pace and style of life. Through training, provision of guidelines, and personal protective equipment, we continue to enhance the understanding and capacity of our frontline workers for this novel disease. I urge all health workers to apply infection prevention and control protocols always and maintain a high index of suspicion for COVID-19. I want to strongly advise citizens against giving false information of symptoms or travel history to healthcare workers when seeking care at this critical time. It's important for me to emphasize this because we've had quite a number of cases where people deliberately chose not to reveal their travel history. And the implication is grave in terms of case management.
At that briefing, the Minister of Foreign Affairs highlighted the efforts of the federal government in bringing back its citizens. According to Mr. Geoffrey Onyema, some of the Nigerians who have expressed willingness to return are from the United States, the United Kingdom, France, Togo and Benin, to mention a few. He adds that all engagements be done with the Nigerian High Commissions in the various states and not any parallel agency.
In addition,
with regards to the question of evacuation, protocol is now well established. We now feel in a much stronger and better position to undertake this Herculean task of trying to see how we can bring Nigerians outside the country back into the country. And in that context, we've now started to get greater numbers of Nigerians, especially in the United States, where almost 200 have now indicated willingness to return. We're engaging with our embassies in China and our High Commission in London and also in France to work out all the logistics, but things are now beginning to fall in place and we're getting a sense of what needs to be done. What is important, I think, to get out there to all the Nigerians is that their engagement and communication should be with the embassies, the high commissions, and not with any other parallel agency, department of government, or anything like that. So it should be channeled through them because it is with them that we're collating the names and making all the arrangements.
Well, the Minister of Aviation has been speaking on the arrest of 2 pilots of Caverton helicopters by a Port Harcourt magistrate court. Speaking at the Presidential Task Force today, Mr. Hadi Sirika expressed that it was wrong for the state government to have carried out the arrest within federal government-owned properties without clearance from federal authorities. The pilots were arrested for allegedly violating the executive order issued by the River State government aimed at checking the spread of coronavirus in the state.
In addition, we have a small team that is providing.
Civil aviation is on exclusive list. Item number 3 there. So no other person but the federal government has authority to legislate upon. So also the Nigeria Air Force, part of armed forces, is also on exclusive list. There's no other person but the federal government that has the legal right to legislate upon. So the Air Force officer who jumped the commander-in-chief and ignored, who also jumped the chief of defense staff and ignored, who jumped the chief of air staff and ignored, to call a governor to come into the property of the federal government belonging to Nigeria Air Force to make an arrest, has exhibited dangerous ignorance and incompetence grossly. So the police that followed the governor also to go in there has also exhibited dangerous ignorance from our perspective in civil aviation. Whether we gave approval for the flight, yes, we did. And we did in national interest. All of those flights are for the purposes of improving the national revenue, to which River State is the greatest beneficiary. So those flights by Caverton, by Aero Contractors, by ARIC, by Bristol, and a couple more were for national interest and improved national revenue. At a time when oil has gone below $30 and the cost of production is $30, in the wisdom of President Muhammadu Buhari, he thought that this be allowed, even in this national pandemic, so that the nation will not be crippled.
In the meantime, just minutes ago, a 15-man medical team from China arrived the country. Members of the team touched down at the Nnamdi Azikiwe International Airport in Abuja aboard a chartered Air Peace aircraft. The Chinese medical team is expected to assist Nigeria in efforts to containing the pandemic. The Minister of Health at the airport to receive them, Dr. Sage Hanire. The invitation of the Chinese medical team by the federal government had been an issue, something of controversy after the Nigerian medical doctors kicked against the idea. Over to Edo State, where the governor, Mr. Godwin Obaseki, today made a frightening revelation as he told the people in the state broadcast that unless citizens conduct themselves better, there will be more cases in the coming days. He also appealed to those who may have already been exposed to submit themselves for screening and proper handling.
As of today, Edo State has 11 confirmed cases and sadly 1 death from COVID-19. Unfortunately, from the evidence we now have, the number of cases are likely to increase significantly in the next few weeks, unless we take very drastic actions now to slow down the spread. We have gathered information that large numbers of our citizens who traveled back home in the last several weeks from overseas may not have self-isolated themselves. Although majority of the current cases are individuals with travel history and those of their relatives, in the coming days we are likely to see community transmission of the virus to people who do not have any travel history. As a result of these developments, we have to now adopt more stringent measures while still trying to protect the livelihoods of our people. Edo State government is very reluctant to have a total shutdown of the state because of the hardship it will cause to our people. However, if we are going to stop the spread of the virus, every person must be involved. It must be a shared responsibility. The government of Edo State will shut down any hotel found to be hosting guests who travel from outside the state and have not informed the COVID-19 response team to screen such guests. All government hospitals and primary health care centers and designated private clinics will be used as screening centers to screen citizens who believe that they may have been exposed or suspect that they may have symptoms of COVID-19.
To Delta State, where the government has confirmed that the index case of the coronavirus pandemic there is in stable condition and receiving treatment in one of the designated isolation centers. Mr. Ifeanyi Okowa was speaking during a state broadcast at the Government House, Asaba, where he called on residents to continue to adhere to precautionary measures, especially with the lockdown directive.
Delta State recorded its incident case yesterday, the 7th of April, 2020. That case is already been moved into one of our 4 management centers, and we have already started the process of contact tracing. The person in question has been in Delta State for some weeks, so he did not just come in from another state during the course of the lockdown. At the moment, we are doing our tracking. We are getting more information on the incident case. And when we have more information, we'll be able to communicate to the state. But it is only the right of that person to be able to publicly tell us that I am infected. I want to assure all Deltans that our health staff have received the best of training. They are in good spirit and ready to go. And I also want to use this opportunity to appeal to all Deltans to pray for our health staff and to support them to succeed.
Let's take a break now. Still to come on our COVID-19 updates, we speak to the Delta State Commissioner for Information. We'll also have more on the global outlook of the pandemic. Please join us again. Welcome back. Now, the State's Commissioner for Delta, that's the Commissioner for Information there, Mr. Charles Aniago, joins us from Asaba via Skype. Thank you for joining us at this time. Please tell us, no one expected that Delta will have an index case. We didn't see this coming. Tell us a bit more about this index case. Was there a travel history? Did the person self-isolate? How did the person contract the virus?
Well, thank you very much. Let me say that we still give God the glory for protecting us thus far, and we still rely on Him to continue to bless the modest efforts that we are putting at the state. As per the index case, he has been in the state for more than a month now, though he lives outside the country, but at least he's been around for quite a while. At the moment, we are trailing and trying to trace those he has had contact with. A team is following that through, and we are comfortable with how far we are progressing. And we can also tell you that the person is responding properly in one of the isolation centers. Of course, you do know that we have 4 in the state. So he has been taken to one of them where he's receiving treatment at the moment.
Would you say you've taken enough measures before now, or that you could have put in place stricter measures to preventing the virus from coming in?
Well, in the first place, if you understand the very, very critical position, geographical location of Delta, you will understand that if he didn't come in before now, it means God has been quite faithful, and then he has been able to bless us via the other steps we've taken. And we are happy that we took steps to lock down the state earlier than a number of other states in the country, because if this person was busy moving from one place to the other, perhaps he may have had cause to further democratize the spread beyond the area where he lived. And that is why we're happy that we locked down the state, and we're still pleading with our people to see the need that in spite of the hardship the lockdown has brought to bear in their lives, that staying in one place, staying at home, and staying far apart in case you need to even discuss with those around you is quite important, because that's the best way we are convinced we'll be able to arrest the spread. We are comfortable where we are at the moment, and we believe that by the grace of God, we'll be able to have, working with our people, be able to at least ensure that there is no spread of this virus in our state.
We wish you the best as you battle this pandemic. Many thanks, Delta State Commissioner for Information, Mr. Charles Aniago, for joining us on the program.
Thank you.
Now, while some states are putting in place palliatives to mitigating the impact of the COVID-19 spread, others are putting stricter measures. Let's run through some of the states, beginning in Ondo State, where traders in Akure, the state capital, they're appealing to the state government to shops, business premises be shut, and residents to prevent the spread of the virus. Elsewhere in Benue State, 23 persons who were isolated for 14 days, and the Benue State government has banned gathering of people from Friday at the mosques, and particularly Easter church services, pending the outcome of the tests. Governor Samuel Otamwa, briefing journalists, also advised residents to maintain social distancing, while churches can utilize online platforms to deliver their sermons. He further notes that come Monday, there will be a review of the existing restriction order, which includes the dusk to dawn curfew, market closure, and restriction of persons above 30. Elsewhere in Jigawa, the confirmed COVID-19 case in Daura, Katsina State, has caused panic because of its proximity to some towns in Jigawa State. The state governor, Badaru Abubakar, who inspected isolation centers in the state capital, Dutse, says they have directed a surveillance team to work with the Katsina State government in identifying people that had contact with the victim. According to him, Kazure, Yakomwashi, and Roni local councils are places that are more vulnerable because of the people who on a daily basis visit Daura for certain activities. And to the southeast Anambra State, the government, they've commenced the distribution of bags of rice, salt, cartons of tomatoes, palliatives through their various community leaders. And part of the economic stimulus package announced by the governor was also the fumigation exercise announced by the government, which has commenced with the flag-off event at the Onitsha main market. Now joining us in the studio for more on the measures to stopping the spread of COVID-19 is Dr. Tolu Olunfulayo. She's a consultant public health physician, chairman, Association of Public Health Practitioners of Nigeria, Lagos chapter. Thank you so much for joining us.
Thank you for having me.
Now we're seeing new cases in new states. What do you think might have happened? Katsina is one example, Delta as well.
Well, obviously, like has been said over and over again, after the cases that have been imported from other countries where, the pandemic initially started from, we're now beginning to see community transmission. And it's more difficult to now trace the contacts. So, for example, in Delta State, you can see they will need to really go and ask a lot of questions to identify exactly how this person got it. And in some of the cases we've had so far, we've not really been able to identify how that person got the virus. And this is one of the reasons why the stay-at-home edict is so important, because as we've been told, you can't get the virus if you don't move around. The virus moves around with people. So people need to stay at home so that they can, reduce the spread of the virus, and then we can flatten the curve.
We also have the Minister of State for Health talking about people giving false information to healthcare workers handling COVID-19. Why do you think this is happening?
Well, it's unfortunate that this is happening, but really one of the reasons might be that people feel they may be stigmatized for having COVID-19, and so they don't want to disclose. But we are saying that the hospitals are ready to receive them. As you can see, day by day, we've been trained, isolation centers have been set up. And if you let us know, you're more likely to be saved, more likely to get help early, because we'll be able to, identify the history and start treatment. And in addition, you won't infect others, because then they'll be able to take additional precautions in handling such cases.
What about hospitals that don't have the PPEs, personal protective equipment?
Well, that's why there are centers. There's a network. So if they do not have, then they'll quickly refer them to a center. In the case of the Ilori situation, for example, if they had disclosed, then they wouldn't have had to go and, do all those burial practices that have exposed so many people to the virus.
Let's go to what President Trump said yesterday. He said the WHO blew it by giving a faulty recommendation saying we shouldn't close our borders or restrict people from coming in earlier. Do you think we perhaps also made that mistake?
Well, you see, there's always that judgment call. For one thing, this is a new virus. It wasn't previously known, so we're just trying to understand it and trying to identify what exactly should be done. And then in our own case, you can see that we are having a different pattern of cases, both in the clinical and in the epidemiology. So we can't say that it's too late or too early. I think we did what we had to do at the right time. And what is important now is for everybody all hands to be on deck for us to be able to mitigate this.
All right, Dr. Tolu Olunfulayo, consultant public health physician, thank you so much for joining us on the program.
Thank you.
And now one European country is worrying figures today is Spain, as death toll rises past 14,000. Single-day death toll rose a second day in a row, up by 757 compared to 743 on Tuesday. It's, however, lower than the record 950 deaths that's reported on April the 2nd, and shows the crisis is far from over in the country. Well, let's take you to perhaps the website of the Nigeria Center for Disease Control, tasked with protecting the health of Nigerians. And it has all the information, statistics, also the cases across states, updates on the COVID-19 regulations. And you can also access emergency contacts as well if you need to. The World Health Organization is, of course, live each day with regular updates on the spread of the pandemic, the number of cases or deaths, and recovery efforts across the board. You can take a closer look at some of the numbers in real time. And that's it on the program at this time. Another update comes your way again at 9. Thank you so much for watching. I'm Millicent Walker.